Australia's health system is one of the best in the world. However, it's also very large and complex, and our ageing population, combined with the rise in chronic disease, means demand is only going to increase. The solution is better primary health care, intervening to achieve superior health outcomes for people before they have to go to hospital. And that's why Medicare Locals are so important.
We work in many different ways. We identify and plug service gaps, particularly through direct clinical services, particularly in the areas of mental health, aged care and Aboriginal health. We support primary healthcare providers, both at the practice level with system improvement, but also on an individual level with education and networking. We also work really hard on improving the patient journey, both into and out of hospital. Everything we do is about improving primary healthcare and thus the health of our communities.
We are very much a clinically focused organisation, right from the level of our clinicians who work on the ground on a daily basis caring for patients, all the way up through our organisation to the level of the board. On the board we have a number of clinicians who've been working in the primary healthcare area, some of them for decades, and so they really understand the sort of services we deliver.
Like the 60 other Medicare Locals in Australia, the Southern Adelaide Fleurieu Kangaroo Island, or SAFKI Medicare Local, collaborates with and supports local health providers to ensure that primary health care works for the 400,000 people who live in the region.
You can be basically fairly isolated out there working in the community, and while you're working in your practice, it's sometimes harder to see what's going on in the wider community in terms of health services. And Medicare Locals can give us some insight into what's going on in the broader health system.
Medicare Locals are a key component of understanding the community through population health planning, through research, getting all this data, interpreting the data and going back to the health professionals such as GPs and of course the institutions such as state and federal health departments and telling them how it is.
From education and accreditation to best practice advice and networking, SAFKI Medicare Local is dedicated to supporting primary healthcare professionals right across the region. This includes collating critical health data at our Tonsley head offices to ensure the profession has an accurate picture of the key issues facing the region, from Adelaide's inner and outer southern suburbs right through the regional and remote areas of the Fleurieu Peninsula and Kangaroo Island. SAFKI Medicare Local also provides frontline clinical services directly to patients in critical need areas, such as mental health, catering for everyone from children through to adults.
When we look at mental health, we're looking at burden of disease across the lifespan, and mental health issues measured against chronic long-term medical illnesses are up there with those sort of chronic illnesses like cancer and diabetes. So having Medicare Local in existence means that we're able to intervene early, reduce the length and duration and severity of disease for these people, but also reduce the impact of people accessing secondary and tertiary mental health services.
Identifying gaps in the health system and providing solutions is a critical part of the role of Medicare Locals. This was never more evident than with the creation of SAFKI Medicare Local's REACH program, which provides the aged with access to regular GP visits in the comfort of their own aged care residence.
All of the nursing home residents, they prefer if they could be managed in the nursing home, which they feel it is almost like as their home. On top of that, obviously, the reduction in the number of presentation in the emergency department or to the hospital has reduced too. So I think it's a win-win situation for both of us.
The health of the region's Indigenous population is also a priority for SAFKI Medicare Local through the federal government's Closing the Gap program.
Our role is to enable Aboriginal and Torres Strait Islander people to access mainstream services and have these services delivered to them in a way that they feel comfortable and they're able to manage their health better and that of their family. And we also work as basically a conduit between the doctor and the client or their allied health service provider.
If people do have to present to hospital, SAFKI Medicare Local also works to make sure patients understand what primary healthcare options they have before, during and after their hospital stay.
So the benefits of integrating the patient journey are, number one, patient safety, but also as a secondary benefit there is cost savings with tests not being repeated and medications not being wasted, that sort of thing. If we make the patient safety our number one priority, and then the cost savings will flow from that.
By empowering patients and helping primary healthcare clinicians, we're better able to help patients access the right care in the right place at the right time. A vibrant, coordinated, integrated primary healthcare system is crucial to improving the Australian healthcare system and thus the health of our communities.